or improving endocannabinoid tone. CBD is a great agent for doing this, and I want you all to consider that, moving forward. So again, this is just basic safety stuff. If you're new to cannabis, definitely start low on the dosing and go slow. If you've never tried cannabis before, using 2 milligrams of THC is a good idea to start that low and slowly increase. What you're aiming for is the lowest effective dose. But like I said, everyone's system is different. So everyone is going to have a different lowest effective dose. You want to choose an appropriate method of consumption. We'll talk about that in a second. Definitely always check for medication interactions. Cannabis is very safe, but it does have interactions. And the more medications you're on, the more chance for an interaction. So definitely consult with, your provider when you're using cannabis in conjunction with other medications. And definitely if you're trying to reduce or replace a medication with cannabis, don't stop it without provider supervision. Definitely, if you're on an antidepressant, cannabis is making you feel a little bit better. Don't just stop taking the antidepressant. That's something you want to wean off of and speak to your provider about. So just some general kind of safety considerations for anyone using cannabis. So, all right, the different methods of consuming cannabis, we went over this in the past too, but, just kind of to give you a breakdown of the main ones, inhalation is the one that people are most familiar with. So that's, John, I'm sorry, I hate to stop the webinar. I keep getting kicked out. Are you hearing me this entire time, or are you missing? Okay,
I'm sorry. We can hear you.
My presenter screen keeps popping back up, so I didn't know if you could hear me.
Yep, you're fine. Keep going.
Okay, so the inhalation. So that's the most common one. Its benefits are it's got a fast onset. It's very controllable. Downsides, lung irritation. If you have any form of lung disease, you don't want to be using this. Chronic obstructive pulmonary disease, avoid inhaled methods. Other people might be able to use it judiciously for the benefit of that fast onset and the easy titration of it. But, it's not my number one recommended method. It's also shorter acting than an ingested method. So an ingested method is an edible. There are a couple different, products in the market now that are fast acting edibles. So that's something, some of those kick in 15 minutes. Others could take up to an hour. You want to be clear on the product that you purchase. If it's fast acting, you can expect to have, an onset of about 20 minutes for an ingested fast acting edible. For a regular, it can take, for some people, depending on your metabolism, up to 2 hours I've seen. So it's very kind of, hit or miss sometimes with the ingestible things. But the benefits of that is no lung irritation, and it has a longer duration of action. So some edibles can last up to 12 hours of relief, a lot longer than you'll get from inhaled medicine. So it's definitely a good method. And these faster acting beverages or edibles that are on the market now are really good options for people who need pain relief fast but don't want to smoke. Another option for that would be the sublingual method. That's kind of a combined method. It's you take an oil or a concentrated oil, place it under your tongue, hold it from anywhere from 90 seconds to really up to 5 minutes, and get absorption in your mouth, and then you swallow it. So that way you get kind of a combination, a faster onset with the sublingual, as well as an extended duration. So it's also very easy to titrate. Clinicians use it all the time. And so tinctures are always a great option, especially if you're new to cannabis and you want to slowly increase your dose. I really recommend this sublingual administration. A couple other ones though, topicals, if you've got joint pain, muscle pain, you can use that liberally. It's not intoxicating. Lotions, creams. We even have some transdermal products that you can apply that have more penetration, that get more into your systemic circulation. So topicals are effective for a lot of people. Don't sleep on those. And then the last one I've added here is specifically because this is a women's health. It's suppositories. So you can use those vaginally or rectally. You, just insert and then lay down, I'd say for about 30 minutes at least, if you can, to prevent leakage. But it I've had patients tell me they get an effect in 5 minutes. I'd say usually 15 to 30 minutes. You'll start feeling some pain relief in that area localized. It's great for, endometriosis, painful periods. It's great for, people that have pain during sex. Often get a lot of relief from these suppositories. The rectal has a little bit faster absorption, but you can use it vaginally too. And it's definitely something worth considering, especially if you have a lot of pelvic pain. I don't recommend that to, all patients, but specifically women with endometriosis, PCOS tend to get a lot of relief from suppositories. So those are basically the methods of consumption.